A very good morning. This is me, Nafisa. Today I'll be sharing information on what is the meaning of PPH, PPH may result in, what are the various treatment options for PPH, how does breastfeeding help in reducing PPH. So let's get started with the meaning of PPH. During pregnancy, placenta attaches to the wall of the uterus. Placenta provides oxygen and nutrients to the growing baby. Placenta removes the waste products from the baby's blood via the umbilical cord. Now let's understand what is labor. Labor is a process by which the fetus and the placenta are delivered from the uterus through the vagina into the outside world. Labor is also known as parturition. There are 3 stages of labor. In the first stage, when the uterus contracts, this results in the onset or the start of true labor pains to the full cervical dilatation. Uterus continues to contract, resulting in baby's delivery or fetus delivery. This is known as the second stage of labor. Once the baby is delivered, uterus continues to contract to deliver the placenta. This is called as the third stage of labor. After the placenta is delivered or pushed out of the mother's body, these contractions will continue and help to compress the blood vessels where the placenta was attached to the mother's uterine wall. If the uterus does not contract strongly, then the blood vessels are not compressed. This results in continuous bleeding and hemorrhage occurs. Hemorrhage means excessive blood loss. Because this excessive blood loss happens within the first 24 hours after delivery or may happen 24 hours to 12 weeks after delivery, hence referred to as postpartum bleeding or postpartum hemorrhage or PPH. Post means after, partum means the act of giving birth or the childbirth. Hence postpartum means after childbirth or after delivery. As the name suggests, postpartum hemorrhage means excessive bleeding after the birth of the baby or excessive bleeding after delivery. The most frequent reason for PPH is when the uterus does not contract strongly after delivery. Excessive blood loss may result in drop in blood pressure. If this is not treated, then this may result in shock and death. How is PPH treated? Or what are the treatment options for PPH? Medicines are used. Medicines most commonly used in PPH management are uterotonic agents. What is the meaning of uterotonic? Uterotonic is made up of 2 words, uterus and tone. So as the name suggests, uterotonics increases the tone and the contractions of the uterus both during labor and after delivery. Examples of uterotonic agents are oxytocin, misoprostol, methyl ergometrine maleate. Other treatment options are replace the lost blood and fluids, surgery, massage the uterus with hand so as to help the uterus to contract. Giving oxygen may also help. Removing pieces of placenta from the uterus. Please note, breastfeeding immediately after birth may be effective in reducing PPH. How? When the baby is breastfed, skin-to-skin contact, which is recommended immediately after birth, or the physical contact between the mother and the baby, or the act of suckling by the baby, helps both mother and the baby's brain to release oxytocin. During labor and delivery, oxytocin causes muscle contractions of the mother's uterus. Who is causing muscle contractions of the mother's uterus? Oxytocin hormone. Oxytocin will help in first stage of labor, that is onset of true labor pains to the full cervical dilatation. Plus oxytocin also helps in the second stage of labor, that is childbirth. Plus oxytocin also helps in the third stage of labor, that is placenta delivery. Also, after the placenta is delivered, oxytocin will help in compressing the blood vessels, therefore reduces the blood flow. That is, oxytocin reduces the risk of postpartum hemorrhage. Because oxytocin reduces the blood loss, therefore also reduces the chances of developing anemia after delivery. Thank you so much. Stay blessed.